This is a video segment to show you that this is the urinary bladder in transfer section, and because I am moving the probe orderly, so this is the uterus. I have magnified the view, and when I move the probe quarterly from this region, you see an area, rounded area, this one, with a central cystic structure within it, bounded by echogenic areas. This is the cervical canal, and this is the cervix in transverse section. Now when I follow this in longitudinal section, see, this is in transverse section, and following it in longitudinal section, it becomes longitudinal, a part of the cervix. So we see a cervix with fluid in it. This is the cervix, the anterior part, the posterior, and this is the cervical canal with fluid. This is the urinary bladder. Now the main study is that this patient is married for 1 year and has reported as suffering from dysmenorrhea since last 4-5 years. Even before marriage, he had dysmenorrhea, and he is having dysmenorrhea after marriage as well. Now, please concentrate on the anatomical landmarks, that if you have seen my normal studies, that you will come across very easily that we see the uterus. This is the anterior wall of the uterus. This one. This is the fundus of the uterus. This is the anterior wall of the uterus. This is the cervix. And this is the endometrial canal. This area in which you see fluid. This is black linear area is fluid within the endometrial canal, which measures approximately 5.5 millimeters, and below it, in the posterior uterine wall, we see an inhomogeneous solid mass, this with irregular outer surface, and it measures approximately 5.89 centimeter into 5.5 centimeter, and this is a fibroid in the posterior wall of the uterus. This is the area of the fibroid. Now, if you see that it is elevating the endometrial canal. This is the endometrial canal. Here, this is the boundary of the fibroid. This is the boundary of this solid heterogeneous, rather mixed mass solid in the posterior wall of the uterus, and it is elevating this endometrial canal. This is the endometrial canal, and this is the myometrium in the fundal region, and this is at the anterior part of the uterus. This is the urinary bladder. So here we are seeing in this section a fibroid in the posterior wall of the uterus elevating the endometrial canal. This is the anterior wall of the uterus, and because of the same reason, the dimensions of the uterus with RNI measuring 10.6 centimeters in length, this is a magnified view 6.4 centimeters in anterior-posterior diameter, whereas the myometrial thickness of the uterus at the fundal region is normal. Myometrium thickness is normal. This is the cervix, and this is the endometrial canal, this area. If I can show you, sorry. Well, this is the anterior part of the endometrial canal, and this is the endometrial canal in the body of the uterus. So, yeah, and this is the fibroid. This is the fibroid. It's all solid, heterogeneous area elevating the endometrial canal, and this is the anterior surface of the uterus. So this is a short segment study regarding solid heterogeneous mass elevating the uterus, endometrial canal, in transverse section. This is the fibroid, and you can see the endometrial canal. Now this is the fibroid in transverse section, measuring 6.0 into 4.8 centimeter, and this is the endometrial canal. Here you see, this is the endometrial canal that is not seen being elevated in this transverse section. This is the myometrium, the anterior, this is the uterus. So the fundal region and the anterior parts are intact. This is endometrial canal. However, the uterus being elevated, the endometrial canal as well as the uterus being elevated is more clearly and obviously seen in longitudinal section. You can see that the endometrial canal is making a curve around this solid mass. This is a solid lipogenic mass, and this is the endometrial canal making a curve around this mass. Again, longitudinal section. And this is the cause of her infertility as well as dysmenorrhea. Though she is not giving any history of menorrhagia, which is more, she should have been complaining of menorrhagia, but there is no history of menorrhagia. This is how it goes. Thank you.